Welcome to Exercise and Nutrition, a guide to living well with cancer. Here you will learn about how important physical activity is during the cancer recovery process. Our experts are from the Edith Cowan University Health and Wellness Institute, where they have conducted comprehensive research into the impact of exercise on cancer. So let's meet our team. First, Professor Rob Newton, an international leader in the field of exercise oncology.
Rest is to be avoided at all costs. We know that if the advice to rest is actually counterproductive, and the outcomes for the patient will be much, much worse.
Next is Dr. Prue Cormie, a senior research fellow who has also received a Cancer Council Research Fellowship to study exercise as a way to manage cancer. Dr. Cormie's research aims to improve the quality of life for cancer patients through exercise.
The biggest message that we need to send here is to avoid inactivity, and that's the clinical recommendations for people with cancer.
And Dr. Carolyn McIntyre, who's here to get you inspired and motivated. She'll help you set realistic goals and show you ways you can keep on track.
The best way to stay motivated is to find something you enjoy doing. If you really don't like doing it, you're never going to do it. And it's to find someone you like doing it with if you can.
This video also has an exercise section with easy exercises and information that will help you get the most out of that workout.
So always really important to have full range of motion.
Let's start with why exercise is important for everyone.
It's important for us to exercise because as an organism, as an animal, we're actually made to exercise and to exercise every single day. We've had to be active every day for survival, to find food, to chase after things we wanted to eat or run away from things that wanted to eat us. And the result is that our body, our actual cells and our DNA actually requires us to be active every single day. If we're not, then a whole series of processes within our body start to break down and start to fail. And that's what causes most of the chronic disease that we experience in the modern times.
So now we know why exercise is good for all of us. So why is it important when you've been affected by cancer?
The overwhelming evidence, both research and also clinical experience, is that exercise is very safe and it's well tolerated by cancer patients and cancer survivors. Modern medicine has been very, very effective at increasing the life expectancy of people with cancer, and in many cases curing most cancers, and that's been a very, very positive outcome. The benefit that exercise has for the ability to fight the cancer itself, your ability to tolerate the treatments that you're undergoing, and also you have a reduced risk of developing other chronic diseases. So your survivability increases quite markedly.
One of the most significant discoveries in recent times has been the impact that physical activity has on some of the unpleasant and often debilitating side effects that people may experience during and post-cancer treatment.
Just about all cancer treatments have some side effects. Certainly with chemotherapy you have high levels of nausea, sleeplessness, tiredness, overwhelming fatigue. The advantage of exercise is that it can actually reverse or completely remove a lot of those side effects. Fatigue's probably the biggest one. It's the most often reported side effect of cancer and its treatment. Now it seems counterintuitive, but if you do exercise, the fatigue actually reduces.
It's also been shown that exercise can help with another important part of your life: sleep.
Exercise has a fantastic effect on sleep quality. So this is a difficulty. Sleep's interrupted for a whole range of reasons, not the least of which is worry about finance and treatment and fear of dying and what's going to happen with my family. Exercise really helps you to improve sleep quality, and lack of sleep really impacts your ability to deal with your cancer and its treatment. And people become very fatigued and very beaten down by the lack of sleep and everything else that's going on. If exercise can improve the quantity and quality of their sleep, then that alone is a fantastic outcome.
While physical activity has proven to be safe for people living with cancer, the amount of exercise you need to do will depend on the stage you are at in your cancer treatment. Professor Newton says there's only one way to find out what's right for you.
It's important that the exercise is appropriate for the patient and their current level of treatment, that the patient is assessed and the exercise is prescribed specifically for them by the appropriate health professional. And in Australia, the most appropriate allied health professional is the accredited exercise physiologist.
Okay, so now that we understand how an active lifestyle is beneficial during cancer recovery, let's move on to the different types of exercise with Dr. Cormie.
Now there's 3 different types of exercise: aerobic exercise, resistance exercise and flexibility. Now each of these types of exercise works different systems in the body in various ways. Aerobic exercise is the type of exercise we typically think of as normal exercise to improve our fitness. So it's out there walking, jogging, riding a bike. If you're in a gym, using a rowing ergometer. It's the exercise that we can do continuously and over a large periods of time. Resistance exercise is the type of exercise you typically associate with going to the gym. So it's actually moving your body against a resistance, which is typically done with a weight machine or your own body weight. The best types of exercise for health benefits and improvements to your lifestyle are the exercises that involve the large muscle groups in your lower body, so your legs, your upper body, your chest and your back, and also your arms. So flexibility exercise is a form of exercise that involves stretching your muscles, and it's really to improve the range of motion around your joints.
All 3 types of exercise are important, and there are guidelines as to how much time you should dedicate to each one.
Well, you definitely don't need to run marathons to reap the benefits of aerobic exercise. Even if it's just walking around the block is very effective. Now in terms of the clinical guidelines of what's recommended of how much aerobic exercise to do, we typically want to achieve 150 minutes of aerobic exercise each week. When you break it down, it's only a 30-minute walk 5 days a week. In terms of how much resistance exercise you want to be doing, the guidelines suggest that you want to try and achieve 2 to 3 resistance exercise sessions a week. Now within those 2 to 3 resistance exercise sessions, we commonly perform between 6 to 8 exercises. Within that again, we have what's called sets of exercise and repetitions of exercises. So typically what we'll do is we'll ask you to do one kind of movement for a set number of repetitions, so that may be 10 times, and we will do that 10 times in a row. That becomes a set. So typically we're going to work between 1 to 4 sets of between 8 to 12 repetitions. So flexibility exercise, typically we'll do it as a warm-up and a cool-down before and after our aerobic and resistance exercise. About 5 sessions a week of some flexibility work, then you're meeting guidelines there. In terms of each individual stretch that you do, you typically want to hold a stretch between 10 to 30 seconds, and you want to repeat the stretch 2 to 3 times for each limb that you're stretching. When we're talking about how hard, we really want to focus on a moderate intensity. So a moderate intensity is, if for example you're walking, it's walking at a fast pace. So if you were late for an appointment and you were rushing to get there, that's the kind of pace that you want to be walking at to achieve a moderate intensity. So a good way to judge if you're working at a moderate intensity is to know that you're actually building up a bit of a sweat and you're puffing a little bit. So you want to make sure that you're able to exert yourself, but you're not exerting yourself too much. So another way to judge whether you're working at a moderate intensity is to use a scale that we call the rating of perceived exertion. Now this scale is to help you judge how hard you're working. We have a target range. In terms of the numbers, it's between 12 and 16. You want to be working between somewhat hard and hard. So in terms of how hard to do your resistance exercise, again, you want to be working at a moderate intensity, so a moderate to high intensity. Now that can be hard to judge with resistance exercise, but typically speaking, when you have a prescribed amount of repetitions in a set, so the amount of times you're doing an exercise, you want to be able to be working against a weight or a resistance that allows you to achieve those repetitions, but not too many more afterwards. You want to make sure that you're not trying to lift too much weight that you can't reach that target repetitions. So if I'm trying to reach 10 repetitions and I put too much weight on there and I can only do 5, then I know that I have to lower the weight down a little bit so I can achieve that target repetitions. So when you're thinking about how hard you have to work when you're doing your stretches, it's really important to only stretch to the point where you have mild tension in your muscles. You definitely don't want to be stretching to the point of pain. That's not going to give you any benefits or additional benefits.
A vital aspect of exercise is progression. This is the steady development that will see your fitness improve over time.
I mean, you'll feel it. It's just listening to your body. So something that was hard maybe a couple of weeks ago starts to become a bit easier. And what's important is, you can't just walk out of the door and start doing 150 minutes straight away. So if you can gradually work up to achieving 150 minutes as an ultimate goal, that's fantastic. But if you can only achieve 10 minutes a day, that's where you start from, and you progress gradually from that point. With resistance exercise, you typically feel a lot sorer than you would with aerobic exercise, but that means that it's actually working your muscles. So it's making little damage in your muscle that then your body is able to build up stronger and better and improve the structure and the function of your muscles. So it won't take long for you to feel the benefits of resistance exercise. In terms of progressing that as well, in a very similar way to we progressed the aerobic exercise, you basically start off by doing the 6 to 8 exercises that you'll be doing, and you progress with increasing the amount of sets that you do and decreasing the amount of repetitions. This will allow you to increase the weight that you'll be moving against in the weight machines or with your dumbbells. So flexibility exercise, your range of motion will improve, so you'll be able to move your body in ways that you couldn't beforehand, whether it's, again, improving the ease at which you can do something, whether it's bending down to pick something up, or, for example, with your shoulder mobility, as I said before, ease in which you can put a seatbelt on or reach to grab things that are above your head. And the important thing to remember is to listen to your body and not push yourself too hard. And to remember that some is better than none, and more is better than less.
So now we've covered why physical activity is important, the different kinds of exercise, and how much you need to be doing. An exercise plan will help you achieve the right amount of exercise for you. Just like everything in life, the best way to reach a goal is with a plan, and exercise is no different.
I think one of the most important things is trying to pick activities you like. So that can be hard. A lot of people have kind of a negative attitude towards different forms of exercise, but trying to find something that you like to do or that you've been drawn to or something that you've done in the past. So something you might like to try, or say, 10 years ago I used to do some yoga or I used to do a bit of walking. So trying to think about those activities.
Here are some other things to consider when making your exercise plan. When it comes to being active, it's important you pick something you'll enjoy, or maybe something you used to do. Then you need to decide the days and times when you can do these activities, and allow enough time to complete them. You'll need to know where you can do the exercises, maybe somewhere close to home. And another great tip is to find someone you can do them with. Ask your family, friends, or neighbours to exercise with you. Support from other people is very important and can help you establish your new healthy lifestyle.
Building a support network can be a really important part of a successful exercise plan. So it's really about, there's a couple of different things you can do. And I think one really important part of it is trying to educate the people who are in your support network about why exercise is important to you. So this is maybe your family and friends, maybe your neighbors, maybe your coworkers, and it's taking the time to tell them, I'm trying to be more active, this is why, it's a part of my recovery. So you're really trying to build in that support from any of the people that you think could possibly be supportive. So what you want to do is ask your friends and family and whoever's in your support network to support your efforts and let your slips go. So it's not about them pointing out, last night you didn't go for your walk and you said you were going to go for a walk. It's about them saying, you didn't quite get the walk in, what can I do to help you out? What if I did the dishes tonight so you could get out and get for your walk? They can also help you by suggesting alternative activities. So say it's Friday night and you're tired and you think, I'm just going to watch a movie tonight. Maybe your partner can say, okay, that sounds great, but what we should do is maybe we'll go for a 20-minute walk and then we'll sit down and watch a movie. So, those can be really good. It can just be that little extra push you need.
As part of your plan, you need to consider if you need any special clothing or fitness equipment.
Anything that you might need. So if you haven't bought a pair of sneakers in 10 years, that might be something you need to think about. Any clothes you might think, if there's a sport that you want to take up again, those are all things that you might want to consider when you're making your activity plan so you can get everything in place and then really try to have a good start on everything.
Finally, try and spread the activities throughout the week. Having a plan to follow will help you make exercise a part of your everyday life. Setting your own goals is an important part of establishing a healthy lifestyle.
So goal setting, there's a couple of different ways to think about it. There's long-term and short-term goals, but we like to talk about goals that are SMART goals.
SMART is an easy-to-remember acronym that will help you set your goals. It stands for specific, measurable, achievable, rewarding, and timeline. Let's start with S for specific.
You want to describe exactly what you want to do. So it's not just to say, okay, I'm going to be physically active. Okay, what do you want to do? I want to start walking, I want to try and do it every day of the week, and I want to do it at a moderate activity, so I'm breathing heavily. So try and be as specific and descriptive as you can in your overall goal for what you want to achieve.
M for measurable.
It's really important, again, if you just say, I want to be more active, it's a really difficult thing to measure. But if you think about more specifically, okay, I want to be able to do this many steps in a week, then you can use a pedometer and try and keep track of how many steps you're doing every day. Or if you say, okay, this week I want to get 90 minutes of activity in, then you can keep track of that and say, okay, yeah, this week I made my 90 minutes, or this week I didn't, and I'm going to have to make a little more time, those sorts of things. And there's lots of great ways to keep track of your activity these days. There's apps for your phone, you can have a diary, you can keep it on a calendar, you can write it on your fridge. So be creative and really try and find a way that works for you to keep track of what you're doing.
A for achievable.
So you may want to pick something that's a little bit lower than you might think you'd ideally choose, so say even if it's doing 10 minutes of activity a day, if you think that's what you can do, then that should be your goal and it should be something that you can achieve.
R for rewarding.
So a goal really, it should be meaningful and rewarding to you. So it's important to keep in mind again, what's the whole idea of me exercising and why is this important? And that can be really good. You can say, okay, I'm trying to do this for my health and to help my recovery and to help inspire maybe other people in your family to be more active and all of those things. But if there's other specific rewards, so you say, if I meet my activity goals, then maybe I'll participate in this, walk for breast cancer or something like that. So it's important to have rewards that are meaningful and important to you that you can incorporate into your routine.
And finally, T for timeline.
It's important in terms of goal setting to have kind of short-term and long-term goals so that you're always progressing or at least trying to maintain towards something. And then what you can do from there is really try and take it down into smaller, more manageable units. So you've got these short kind of manageable weeks that you can say, this week, okay, I'm going to try and walk twice a week for 10 minutes. Next week, I'm going to try and walk twice a week for 12 minutes. And you can gradually build up to meeting that goal.
Making the changes required for a healthy lifestyle can often be easier said than done. Even with the best of intentions, you'll meet barriers along the way.
Yeah, I think dealing with barriers is a tricky part for anybody trying to take up a physical activity program. And for cancer survivors, it can be just that little bit more difficult. We know from research that cancer survivors, and particularly people on treatment, have different types of barriers. So there's actual cancer-related barriers. So for patients on treatment, this might be nausea, fatigue, hospitalizations, actually the time it takes to get the treatment could all be barriers. And that can account for as many as 50% of missed sessions in research we've seen. But the thing is, they also have all these other life-related barriers.
Let's look at some of these common barriers and the ways you can overcome them. Starting with, I'm too tired, which is one of the most common side effects of many cancer treatments.
So it is important to be flexible because you may find that your fatigue is worse on some days than it is on others. So one day you might think, you know what, I've done 5 minutes and I'm really tired. And that's okay. Do your 5 minutes that way. You might feel better the next day and be able to do 10 or 12 minutes of activity.
Here are some of the other things to try if you're too tired. Exercise on the days or at the time of day when you feel less tired. Break up your exercise into shorter sessions. If you're feeling very tired, listen to your body and take a break. Build up the amount of exercise slowly. The amount of exercise you do may change day to day. Try to be flexible and remember some exercise is better than none. Perhaps you've heard yourself say, I'm too busy and I don't have time to exercise.
It's important to say this is a priority for me, I need to make time, and to try to schedule in time throughout your day that you can actually fit it in.
Or it could be you just don't like exercising.
So if you don't enjoy exercising, try to pick something that you might enjoy. So try walking, try incorporating things with family and friends. It's always more fun when you do it with somebody that you enjoy spending time with.
I feel too unfit.
Yeah, try not to compare yourself to what you could do before your diagnosis, because the cancer journey is difficult. It's a lot of treatment, it's a lot of ups and downs. So just think, okay, this is where I am right now, this is what I think I can achieve, and gradually build up from there.
I have other illnesses that make it difficult to exercise.
So this is a completely understandable barrier for many cancer survivors. So whether that be arthritis, a lung disease, some peripheral neuropathies, or something that might be getting in the way of being physically active. And it's important to keep in mind that exercise has actually been shown to be beneficial for many of these other chronic diseases or other side effects that you may be having.
And what about the weather putting you off?
If you can look and see, okay, it looks like it might rain tomorrow, what can I do instead? I was going to go for a walk outside. I don't think I'm going to want to go if it's raining. So think about other places in your area that you might be able to go. So the shops are a great alternative because it's nice flat floors, usually quite climate controlled. It's not usually a problem. There's bathrooms, there's benches. So when the weather gets in the way, try to think of an alternative that you might be able to use.
On the road to a healthy lifestyle, it's normal to experience setbacks along the way.
So yeah, what are setbacks? Setbacks are things that get in the way of your progress as you're trying to take up physical activity or take up an exercise program. And the most important thing to remember is that it's completely normal. It happens to everyone who tries to make any kind of behavior change. There's going to be setbacks, and there's going to be times that you're less successful at incorporating those changes. So by really looking at specifically exactly what the problem is and being honest about exactly what the problem is, you can then try and come up with a specific solution to help you fit activity in the next day.
It's how you respond to setbacks that will determine the progress towards your goals. The Setback Planner is one tool you can use to get back on track. It works like this. For example, if you feel too tired to do a 30-minute walk, you might instead choose to do a couple of 10 to 15-minute walks. When? Maybe in the morning before treatment or perhaps after dinner. Sticking close to home should make it easier. Then make your final plan, which could include finding an exercise partner. When you are getting out and being active, it's just as important to know if there are times when you need to stop exercising.
Really important to keep in mind and be wary of some indicators that tell you should stop exercising, and stop exercising immediately and have a chat to your general practitioner. Now this is really important because while exercise has a lot of very significant health benefits, you don't want to be exercising to the point that's actually causing some issues with your health. And there's some key factors that we want you to keep in mind to make sure that you're exercising safely. You should stop your exercise session immediately if you experience any of these situations. You feel faint or dizzy, you feel nauseous, your heart is beating rapidly or your pulse is racing, you have chest pain, you have blurred vision, you feel suddenly short of breath or have difficulty breathing, you feel suddenly weak or tired, you experience numbness or loss of feelings in the hands or feet, you feel confused or disoriented, you have sudden joint pain or bone pain.
So now you know why exercise can be beneficial for people with cancer, and you've seen the types of exercises that you need to do. We've also given you the tools to make your own exercise plan to guide you down the path to a healthy lifestyle. Let's hear from some people who've been affected by cancer who've done just that.
I found that since doing regular exercise and a wider range of exercise, I've actually gained a lot more energy, and that's been really good. Also, just the general sense of well-being. Sometimes I don't feel very motivated getting up, thinking, oh gosh, I've got to get up there and find parking. But then after having done the exercise program, then I always feel a lot better.
You can feel, as I did during treatment, absolutely terrible, but you've got to do something. It's basically get off your bottom and go and do something. Go for a walk or do whatever you can, but move. Don't lie around, move.
I guess I didn't have any motivation when I started, and it was really as I started to progress and be able to do things again and to feel better in myself, that just kept me going. And then at the end of my program, when I had my reassessment, and I could see the difference and how far I had come, in every aspect I had such an improvement. From that moment, that's what motivated me, and from then on I decided that exercise was going to be a part of my life forever.